I'm Jennifer Turner, and this is my video for hip dysplasia for Vet 122 spring of 2013. We're going to talk about hip dysplasia today. Hip dysplasia means the abnormal development of the hip joint. Okay, that's all. This means abnormal, and plasia is the joint, so it's just the growth. It's just abnormal growth of the joint. This can lead to degenerative joint disease, which is also can be called osteoarthritis. So this causes pain for the pet. Walking, it causes some lameness, and it's a trait that you don't want to continue to breed into a line. So a lot of people have their puppies checked to see if they're prone to hip dysplasia before they breed. There's no cure for hip dysplasia. You can only make the pet more comfortable with anti-inflammatories and things of that nature. Okay? In order to x-ray a hip needs to be completely relaxed. In order for the hip to be completely relaxed, generally you have to sedate the patient. Getting a patient to hold completely 100% still long enough to get good films is quite difficult. So there's a couple ways you can do it. You can use dexdomitor, and then when you're done, you can use antecedent to reverse it. Okay, and the doses of these are per your veterinarian, because it depends on the pet. The other option is an IV catheter and propofol. Propofol is usually about 4 milligrams per kilogram body weight, but it's to effect. So you would push a little into the catheter, see how it goes, push a little more, see how it goes, until you were sedated enough to do your x-rays. Okay? Also for the pain, if this is a young puppy that you're testing, there may not be any pain involved and you may not need any kind of pain relief. But if it is an older pet that you're trying to check the hips and see what's going on, if they've come in for a lameness exam, then you might want to give injectable Rimadyl, or it's Carprofen, but the brand name is Rimadyl, and we generally give it at 4 milligrams per kilogram. Okay? So if you're talking about doing the hips for grading, there's two basic camps for that. There's the OFA, which is the Orthopedic Foundation for Animals, and then there's the PIN-HIP, which is Pennsylvania Hip Improvement Program. Okay? So there are two different thoughts on how to grade the hips. The Orthopedic Foundation for Animals does the one view. They like the one view that is the hip extended view, where you pull their knees and make them parallel, okay, which is the extended view. The PIN-HIP, they like at least 3 views. They have 3 special views. They have a special tool called a distractor that they put on the abdomen of the pet while they're doing the x-ray, and then they have a compression view that they like, and then they use the hip extended as well. But for the PIN-HIP x-rays, you must go to a PIN-HIP certified doctor, and you have to find one, so not just anyone can do them. It has to be a specific person who does them. Now for the OFA x-rays, it can be just about anyone. Any veterinarian can go ahead and do those x-rays and submit them to be graded. Okay. We have the equipment we need to go ahead and do the hip x-rays. I've got my attire on, I've got my badge, my thyroid shield. My leg gloves are right here. I have my caliper out. I've got my chart. I've got my little R to put on the right side. I've also got some positioning aids that you can use to help with the position for the x-rays, to hold the patient still in the right position. So we have boats. We call them a boat. It's just a foam bed that the patient can lie in. Okay. You could also use ties. Another thing you could use to help yourself out are like sandbags or things like that. We don't happen to have any at this hospital, but I know other hospitals. You can use foam blocks and different positioning aids to help align the body parts properly in parallel position to the table or to each other. Okay? So exposure factors for the hip x-rays. The hip requires 50 to 75% more MAS than an abdomen because of the density of the tissue. So we have a chart that tells us automatically that information, but if you didn't have that, you would need to increase the MAS by 50 to 75% based on your abdomen rate. And I'm going to use the calipers, and we're going to measure her hips. So if I go across here, I get a nice measurement of 20 centimeters. I go across here, and I get, so that would be for the lateral view, across the hips like this for the lateral view, and for the VD view, 26. So the VD view, you slip it in like that, and then she would be sedated. But for this video, we just have Mrs. Taylor here as our volunteer. Okay. So there are a few different views you can do. The most common view and the view that's used by the OHA is just the extended hip. That's where you take the hips, you take the little, and oftentimes you tape down their tail, okay? And you make sure that they're parallel, and you pull on the hips and take the photo like this. Now in a sedated animal, it would be absolutely parallel and straight, okay? And you would also turn on your light and get it collimated properly. So if Taylor were sedated, we would have her hips perfectly parallel to the table and her knees turned and parallel to each other, and we would take our shot, okay? All right, Mrs. Taylor. There are a couple other views you could do. You could do a lateral view. If you were to do the lateral view, you would have her in right lateral position. Don't forget your little arm marker. And you would make sure that our hip bones were perfectly parallel on top of each other, one on the other, so it looks like it's just one bone, not skewed. And then you would take the bottom leg and pull it a little bit more cranially, and this one a little back, if you were going to do the lateral view. Okay? And then there's two more views that you could do, and they use it for the pin hip. And that's this view, like it's like a frog leg view, like this. And they have a tool they use to, they call it the distractor that they put on here for the hips for that view. Or they use the compression view, and where they push down and compress the hips. All right, so those are your positions. And as long as you have your machine set right, and you have it collimated properly and everything parallel, you have some beautiful hip radiographs.